The number of drugs dished out to children to control attention deficit hyperactivity disorder, or ADHD, has nearly doubled in the past 5 years, Channel 4 News has learned. An investigation by this programme has uncovered evidence that drugs are being given in increasingly high doses and to youngsters under the age of 6, against national guidelines. Today, a group of experts is calling for an urgent review, as our health and social care correspondent Victoria MacDonald reveals in this special report.
He was just always my little boy. I loved him. I miss him.
Harry Hucknall was 10 years old when he died at his mother's home in Cumbria last year. His father, who lived several miles away, told us of the moment he learned what had happened.
I got a knock on the door, 2 policemen there. Oh, what do they want? And they just come in and told me my son was dead. And that they'd found him hanging in his bedroom.
They can't repeat that in the exact words. No!
Inevitably, there were questions to be asked, not least because at the time of Harry's death, he was on a drug for depression and another for attention deficit hyperactivity disorder, or ADHD, something his father had been very unhappy about.
It seems strange to me, he managed OK up till the age of 10, not being on these drugs. When I questioned the doctor on the inquest, he told me my son had a chemical brain imbalance. And I said, well, how do you know that? Did you take chemicals from his brain? And his answer was, it's a theory. So, time travel's a theory. Give me a time machine, I'll go back and not put him on tablets, maybe he'll still be here.
And it isn't just Harry's father asking questions. At the inquest, the coroner said he'd died because he failed to understand the true consequences of his actions. And while it was difficult to say what part the drugs had played, he did query the wisdom of prescribing them to young children. Thousands of children like Harry Hucknall are diagnosed with ADHD in Britain every year, and that number is growing. But what his case highlights is the real concern there is over the way they're being treated, the drugs that are being used to control this disorder.
As more and more is known about neuroscience and the development of the brain, there are concerns that we're not entirely sure about the long-term effects of the use of some of these, what are actually quite powerful drugs, on the development of the brain in what's sometimes very, very young children.
Most of the drugs for ADHD work in a similar way, by easing the symptoms. In many cases, they work effectively. But figures obtained by this programme show a massive increase in the amount of ADHD medicine being prescribed in Britain. 5 years ago, 389,000 prescriptions were handed out by doctors. By last year, that figure had nearly doubled. And what we've learned is that these drugs are being handed out to children at an increasingly young age. There are numerous drugs for treating ADHD. Ritalin's probably one of the better known ones, but they all have one thing in common, and that is the recommendation that they're not given to children under the age of 6. Yet our findings show that these guidelines are regularly flouted.
You're going to put that down for me? Yeah.
And this is Kenneth Hanney. He's now 9 and, according to his father, he's been on ADHD drugs for 4 years.
He was first diagnosed when he was 5 years of age. Within a week, they actually put him straight onto medication, which was Equazine.
And how did you feel about your 5-year-old son being on medication?
I wasn't happy, but again, as at that time being on my own with the kids, I didn't know which way to turn. Can we have a go?
How unusual is Kenneth Hanney's case? In fact, it would seem that it's all too common. Dave Traxon, who's worked as an educational psychologist in the West Midlands for more than 30 years, says it's now time to break the silence.
The most worrying breach of NICE guidelines is the number of children under 6 that are being given medication. And that's methylphenidate. And in the West Midlands, we estimate that runs into hundreds. And so that's hundreds of children between the age of 4 and 6 that are having a major central nervous system stimulant on a daily basis.
Best practice and national guidelines state that for most children with ADHD, counselling or therapy should be the first choice. Only then should drugs be considered. All the national guidelines say that you're meant to be offered support and help before your child is put on this medication. What happened with you?
Unfortunately, the doctors put him straight onto tablets straight away and says, there you go, give that a try and we'll see you in a couple of months. And that's all we had.
So 4 years he's been medicated on stronger and stronger doses.
Yeah.
And at no point have you been given any of the other support that you're meant to have?
Nothing whatsoever. Absolutely nothing at all.
Just outside Worcester is Norton College, newly set up for children excluded from mainstream education. The head teacher has spent 35 years dealing with often troubled students.
When I first started teaching, virtually no child had any medication at all for their behaviour. But over the years, and more recently, the percentage has gone out of all proportion.
And here is an excellent illustration of the precise problem. In this room behind me, playing football, there is only one child who is not on medication. And yet the head teacher says that in most cases, it is not necessary. You're not suggesting that there aren't some children who absolutely do need that medication?
There are some children who need medication, certainly, there are some, and there's no doubt about that. But what I am concerned about is there are too many being prescribed it too easily, too readily.
And, he says, doctors are regularly ignoring the national guidelines, which say that teachers should be consulted before the children are put on these drugs or the doses changed.
Recently, a young lad who was having some difficulties at home socially was taken to the doctor by his mother. Prior to this, he'd been doing very well at school. The doctor, without consulting us, doubled the child's medication, which has now meant the child has come to school in a lethargic state and is not able to achieve at the same level as he was previously. It's disappointing for me because that child was doing very well in school and the lack of consultation there has, in my view, affected his education.
None of the experts we've spoken to are criticising the ADHD drugs themselves. When prescribed correctly, they do work and have helped many children. But the concern is that some doctors appear to be dishing them out too readily and without ensuring they even have the right diagnosis. Stephanie Peach is now 11 years old. At the age of 8, she began to exhibit symptoms that resembled ADHD and was immediately put on Ritalin.
The only thing that the Ritalin did for Stephanie was help her to hide and mask her true difficulties.
In fact, Stephanie has a form of autism and has now been taken off Ritalin. But her mother believes some damage has already been done.
She's really struggling at the moment in Year 7. She's in a mainstream comprehensive and she can't cope. She's finding it extremely difficult to cope.
Not going back.
As she says. I'm not sure at all what benefit the Ritalin had educationally. Each time I expressed this to the paediatrician, it would increase Stephanie's dosage.
Stephanie's dose was kept within national guidelines, but experts we've spoken to say some children are on doses twice the national limits.
Many are being given over 100 milligrams and a lot are being given nearly double the maximum dose, and that would translate into many thousands across the country.
But with more and more evidence that there is a problem, the professionals, teachers, psychiatrists, psychologists are beginning to say enough is enough. We can't keep treating our children like this. And today, the Association of Educational Psychologists issued a statement calling for immediate action, a move that's backed by the British Psychological Society and the National Union of Teachers.
We're calling for an urgent national review of the use of psychotropic drugs, sometimes better known by things like Ritalin, their use on children because we're concerned about the long-term effects.
If they had a life-threatening disease and they were giving them some drug that was going to save their life, I can understand. But as far as I'm aware, that there's nobody dropped dead of ADHD. Is there not? Yet my son's in a coffin because of as far as I'm concerned, the drugs he was put on.
That report from Victoria MacDonald.